Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight, webinar where we talk about Lyme disease. For those of you that are new, welcome. The way that you participate is two ways. Number one, you can listen to answers that I give to questions that are written, or you can be bold and you can actually write a question to me. And you can do that by over on the right-hand side of the screen at the bottom is a chat box. You write your question to me in that chat box. The only thing I ask is to do short questions. If they get to be too long, I just can't post them here. They actually jam up my computer, unfortunately. And if they are too long, I probably just won't even post them. So just be aware of that, okay? So this format works best with short questions, all right? And then the other thing is click the enter key only when your whole question is complete to send it to me. So each time you hit the enter key, it actually sends a separate question to me, which can be hard to decipher from my end, okay? And then I see a lot of familiar names here again, so I'm glad to see that you're back here again, and I hope we can keep offering some information that you find helpful on your journey through this thing called Lyme disease. Tonight, I'll answer your questions to the best of my ability. Sometimes you stump me. Sometimes I learn a thing or two from you, and I hope you are able to learn a thing or two from me as well, too, okay? So tonight we are Basenji free. My two Basenjis who usually come here with me are not here right now. So you won't. For those of you that like to see Thor jumping around in the chair back there, he's not going to be doing it tonight. Okay. And the last thing is I am doing a recording of the webinar tonight as usual, and probably sometime tomorrow morning. I'm hoping for by around 9 or 9:30 in the morning that I will have the edited version of the video ready, along with a brief synopsis that I usually write about that. And I'll send it to you through the email, okay? So if you happen to miss that, you can actually go find the recording of the webinar on the webinars page, which I usually show it there. I apologize for last week. I forgot, I did get the video completed, but I forgot to turn it from being privately seen on YouTube to being seen publicly. And somebody later in the day let me know that. I'll try to make sure I handle that correctly this time, all right? All right, and then finally, tonight is the last webinar that we're gonna do until August, all right? So I'm off next week. Actually, I usually take the fourth week off, but also I've got pressing family matters. I'm helping my senior dad move into assisted living out in Colorado Springs. So for those of you in Colorado Springs, I might run into you. I'm looking forward to getting out there, but also to help him and move on into another phase of his life. So anyhow, tomorrow morning you will, in the email I send out, there'll be a link to sign up for the next series of webinars in August, okay? All right. So without any further ado, let's go ahead and get started here. All right. Hello, Gail. Let's see. Hi, Dr. Ross. Can rifampin induce hypothyroidism, especially in those with anti-thyroid antibodies and an elevated TSH, but who are subclinical and currently not being treated for hypothyroidism? I have a slightly elevated thyroid stimulating hormone and positive TPO and was going to start rifampin for Bartonella, but now am very hesitant. Have you had patients with subclinical thyroid disease develop hypothyroidism or worsening of clinical hypothyroidism on rifampin? If so, how common is it and how do you prevent this, minimize this? Also, I am just on Augmentin for a UTI. Labs came back low platelets at 142. Lab range went down to 150. Would this be of concern to you? Okay, so first of all, I have not seen in people that are not being treated for hypothyroidism, I have not seen that rifampin leads to hypothyroidism. Rifampin does alter metabolism of thyroid medication when you're on it, making it so that sometimes what the levels that you had been on that were working stop working. So bear with me a minute. I'm just looking up to see in my drug directory, does it ever lead to hypothyroidism on its own? I think the relationship only is that it changes how your body processes the thyroid medications you're taking, okay? So hold on here just a minute. Yeah, I think it's more related to if you're taking it, you're not using your natural thyroid, but rather you're taking thyroid medications. That's where I've seen it occur, but not that it caused you to develop worsened thyroid situation from being on it. Okay, all right. And then in terms of your question about augmentin, so any antibiotic that we're on can lead to bone marrow suppression, can suppress the ability of the bone marrow to make the cells that are made there. Okay, so those cells that are made in the bone marrow are your red blood cells, your white blood cells, your platelets. Platelets are cells that are used as part of blood clotting. Okay, so it's possible the augmentin caused that to become low, but also when I get somebody that I've been managing for a while that has normal platelet levels and suddenly they have a low one, I will often go back and recheck to make sure it wasn't a lab error. In other words, I'll repeat the blood study. I don't often think of augmentin as being a drug that does bone marrow suppression. Ones that I tend to think a bit more of doing bone marrow suppression because I see a bit more of it would be the tetracyclines can do it more easily than an augmentin can, and also the sulfa antibiotic called Bactrim, also known as Septra, also known as sulfamethoxazole trimethoprim. That one can also suppress the bone marrow at times too. Okay. All right. Thanks for the question, Gail. Good luck to you. Hello, Jim. Let's see. Thanks for helping us Lyme patients out. You're welcome. You've mentioned in past webinars that some people develop brew pubs in their sinuses due to yeast. Yes, I have said that. I'll try to explain more what I mean by that here in a minute. Let's see. How do you treat this and shut the brew pubs down? Also, does one need to use sea salt, Himalayan salt, or other fancy salt, or is plain table salt okay as long as it doesn't have sugar as one of the ingredients? All right. So when I talk about brew pubs, let me tell you what I mean by that. So, and I'm usually not referring to yeast. I'm referring to mold infections that can occur in your sinuses. So let's talk about that. So there's this condition called mold toxicity, okay, where you have excess amounts of mold toxins in your body and you can't get them out. So what happens in 75% of people is if we are in an environment where we breathe in mold toxins, like there's mold behind the walls, that's black mold, for instance, and it's releasing toxins, and I'm in that environment, I'll breathe in those mold toxins and they will get absorbed from my lungs into my bloodstream and they're in the blood then, okay? And in 75% of us, what happens is our immune system sees those mold toxins, attacks them, and breaks them down, okay? But there's 25% of us that have a genetic programming error where our immune systems do not see those mold toxins and they don't get broken down. So they become trapped in us, okay? Now, those mold toxins is the part of the body trying to deal with them will get processed by the liver. The liver likes to take fat toxins like mold toxins and tries to transform them into water-soluble toxins. And as water-soluble toxins, they're supposed to be moved out into the intestines, mix in our poop, we poop them out. But the liver can't handle mold toxins either. And so the liver sees them and is not able to transform them from a fat-soluble toxin to a water-based toxin. And so they go out into the intestines as a fat-based toxin and they get reabsorbed again, okay? So when we're treating somebody with mold toxin illness, the way we find out they have it is we do a urine test because you will pee out a little bit of the mold toxins too. And if you're peeing out excessive amounts in a urine test, then we say you probably have mold toxin illness. And we want to remove them. The way we remove them is by having you take substances we call binders, like charcoal and clay and a prescription called cholestyramine. There's all kinds of binders we can use that grab hold of these toxins in the intestines so they don't get reabsorbed again. Now, if I'm treating somebody for mold toxin illness, I want to go back in about 3 months, 4 months, and retest them to see that those mold toxins are coming down. And if they're not coming down, then I start wondering, did they pick up some mold spores? Did they get mold spores also breathed into their sinuses? and possibly swallowed down their throat and got into their intestines, where they become colonized with the same mold that was from their environment. And if they're colonized with that mold, it's very possible that the mold in their sinuses and the mold in their intestines is producing the toxins. And that's what I call a mold brew pub. Okay, you're brewing up your own toxins, your mold that's living in you. Okay, that's what that was about. Now, we don't have good tests to say that you are colonized with mold or that you are colonized in your intestines. So we make a decision, I make a decision to treat for mold colonization and the brew pub, if you will, based on you're not responding to the binders. And so if you're on a good binder regimen and you're not getting better, then you got to start wondering, are you producing your own toxins from mold living in your sinuses or living in the intestines? Okay, all right. And then in terms of what do you do? Well, you wind up getting on mold killers. And generally where I'll start is I like using something for the intestinal mold called itraconazole. It's a drug. It's a 100 milligram pill, and I usually will do 2 pills 1 time a day in an adult. Some of that itraconazole gets absorbed into the bloodstream and will leak back into the sinuses. But also in the sinuses, I also like to use an antifungal nose spray in the sinuses. And that could be things like either nystatin nose spray. You can do an amphotericin nose spray. You can do colloidal silver nose sprays, usually about 10 pumps twice a day in each nostril is what I will wind up doing for that too. Okay, so those are ways that you can try to get rid of it. So usually on an oral antifungal that gets into the intestines, also some of that gets absorbed, gets back into the sinuses, and then I use some kind of a spray antifungal, which can be either nystatin, amphotericin B, itraconazole. We can do that way too, and then or you can do the colloidal silver. Okay, all right. So let's see here, and then in terms of the salt, I don't have people do anything fancy with salt. I mean, I think any of these salts are fine. The problem with some of the salt you're going to get at stores, unless it is sea salt, and unless it is Himalayan salt, like a Morton salt, for instance, they have anti-caking chemicals that are added to the salt. And I don't know if you want to be putting something foreign in you that's called an anti-caking substance, okay? So I usually try to use either Himalayan sea salt or, Himalayan salt or sea salt, because I know they're not going to have these anti-caking additives put in, basically, okay? All right. Thanks for that question, Jim. Hello, Dominic. Let's see. Hello, Dr. Ross. I just started my treatment this Monday. Wow, that's very recent. Let's see. Congratulations on getting that going, by the way. This Monday with azithromycin and malurone and feeling a little bad on them. Is it okay to get the COVID vaccine while taking these antibiotics? Also, should I wait a few weeks to get more stable and let my system adjust to the antibiotics before getting the vaccine? Is it best to wait and see if I will get a bad Herx reaction from the antibiotics before getting the vaccine? I'm concerned that I might experience both a bad Herx reaction and a bad vaccine cytokine storm at the same time and really knock me down. Lastly, should I stop taking probiotics 1 week prior to taking the vaccine as you recommend? The curcumin and glutathione. Thank you. Okay. So Dominic, one thing I'm going to just talk in generalities because I cannot tell you what you should do. That's for your doctor and you to decide. Okay. And I'm not your doctor. I may answer questions here and give you some things to think about. But for this kind of advice about vaccines, when and when to get them, when or when not to get them, I really prefer that you talk to your own doctor about that. Okay. All right. What I will tell you is when you start treating for Lyme with antibiotics, you may get worse temporarily, and that's due to something called a Herxheimer reaction. So in a Herxheimer reaction, your immune system sees the dead germs and manufactures a bunch of chemicals called cytokines. And cytokines are good and bad. On the good side, they turn the immune system on. On the bad side, if they're made in excess, they can give you a lot of what we call Lyme symptoms, which is the brain fog, the body pain, fatigue, achiness, all that stuff. Those are usually excess cytokine symptoms. Okay, now, when you get the COVID vaccine, guess what that's going to do? Well, it's going to trigger cytokines, all right? So when the major reasons people do have side effects when they get the vaccines, everyone does, 99% of the time, they're all short-lived, and probably even greater than that. But you will get a flare from getting the vaccine most people do. Will get achiness, will get fatigue, may get some brain fog, and it can range from days up to even a week or longer in some people, okay? And the majority of those side effects also are cytokines, all right? Because when we give the immunization, it tells the immune system to make cytokines. Cytokines trigger then the whole immune reaction to take place so that our bodies learn to defend itself against COVID-19. So do you want to start a new antibiotic and get the vaccine at the same time? You can, but just realize it's going to make you feel a lot worse. And regarding whether you should wait or not wait, I would rather you talk with your provider about that, who understands everything else that's happening with your health, more so than I do with this brief question here, okay? And then in terms of probiotics don't have anything to do with cytokine levels, all right? And in general, because again, we want the vaccine to trigger a cytokine surge, because it's those cytokines that are telling the immune system to learn to become immune against COVID. Generally, my thought has been, when possible, don't use anti-cytokine herbs like your curcumin or your glutathione. There is an occasional person that I know has a tough time every time we do something new and they just get really knocked down, that I might still have them stay on their anti-cytokine herbs and supplements as well too. Okay? All right. Dominic, good luck to you, but I definitely bring this up with your physician who knows you better than I do. Okay? All right. Good luck to you. Let's see here. Hello, Rainey. Let's see. Hi, Dr. Marty, or Dr. Marty. Overread that. Let's see. How are you? I'm doing fine. Thank you. Let's see. I hope you are doing great. I was wondering what your thoughts are on the role of the thymus gland in Lyme. I read your article about thymic protein A and was wondering what you think of similar products, such as, but not limited to, thymus gland extract, or even thymus extract injections. Thank you so much. So let me answer that. So and thanks for that question. It's a good question. So Rainey is asking about the thymus gland. Okay, so the thymus gland is an organ that sits here in the chest, right underneath your chest bone. And when we are young, it's quite large actually. And as an adult, pretty much shrinks up and almost becomes non-existent. It's just they're very small. So the thymus gland is an immune system organ. It is a place where white blood cells, is where chemicals are made that stimulate white blood cells to be made and to try to attack a germ, basically, okay? And one of the proteins that's manufactured by the thymus gland is something called thymic protein A, that is known to turn on cellular immunity. So cellular immunity, when we have immunity, there's antibodies we make, which are proteins that attach to a germ. And then there are cells that we make that attack germs as well too, okay? So white blood cells, basically. And the thymic protein A is known to create more cellular immunity, turn on the cells that are going to attack germs, all right? So, does that really help in Lyme? I haven't really seen it give much benefit to actually just try to turn on cellular immunity. I have seen it to be useful in people that I'm trying to treat more viral infections. I do see that it'll make a difference there. And that's why in my article about thymic protein A, I talk more about viruses. But in terms of something I have people take on a regular basis and whether I think it makes a difference for chronic Lyme infection and bacteria infection, I haven't seen good benefit from that. So therefore, I don't think that by extension, I don't think there's much benefit in getting thymus gland extract or thymus extracts as well too. Okay. All right. Thanks for the question, Rain. Good luck. Let me just do a quick screen share here so everyone knows what I was just talking about there and what Rainey was just asking about too. All right, so so this is my Lyme disease information site, and to see when I recommend thymic protein A, there's an article I would take a look at. Look in the infections section here, and look under virus treatments. Well, I got some article here on viruses. Where do I have it here? Here we go. This article called When and How to Treat Chronic Viruses in Lyme, a Brief Guide, is where one of the places that I talk about the thymic protein A. And it's in this section here about what do you use to turn on the immune system, okay? In addition, I have an article just on the thymus gland and thymic protein A. You can read about it here. You'll find this in the immune section, okay? So that's where you can get that kind of information, all right? And then the product that I like to use, if I am gonna do that, is a product called ProBoost. And this is the product here. All right, and again, so that's it. That's what he was talking about. Okay, all right. Let's go back here. Somewhere here. Oh, there we are. Okay. Had to find my way back to the webinar screen. I got lost in my computer for a minute. Anyhow, I hope that answers your question, and I wanted to show everyone what we were talking about there with that response, okay? Hello, son. Let's see. Hello, Dr. Marty Ross. Thank you for the article, Kills Babesia. It says that doxycycline could possibly be used with mallarone for Babesia. I'm curious to know if the doxycycline in this case is included for Lyme, or does it help in itself against Babesia too? In other words, do antibiotics help with Babesia as it is only antimalarials? Thank you so much. Okay. So Babesia, as many of you know, is a blood parasite, which is very similar to malaria, which is another blood parasite, all right? So things that we know that can treat malaria, we often use to try to treat Babesia. In terms of studies that have been done looking at what works on Babesia, there is only one research project that's ever been done. And you would think, given how important Babesia is, there would have been more clinical research in humans looking at what do you give. But in this one study, what was used was something called azithromycin. It was azithromycin, the antibiotic azithromycin, and also atovaquone, which is also known as a mepron, okay? And I think it was a 10-day or 14-day study. That's it. No one has ever looked to see, are there other combinations of medicines that work effectively to treat Babesia in a study, but based on that azithromycin atovaquone study, we often have created other treatments that work in a similar way, okay? So why is it postulated that azithromycin should be put with the atovaquone? The reason is, even though azithromycin is a antibacterial antibiotic, we do think it has some activity against Babesia, not the strongest, but some activity. But we also postulate that it helps prevent the germ from becoming resistant to the atovaquone, okay? Now, what else could we substitute for that azithromycin? Well, if azithromycin works, then maybe other drugs that work in a similar way would work. All right. And so other drugs that work in a similar way, similar mechanism of how they work, would be any of the other macrolides. So azithromycin is in a family called the macrolides. One of the other big macrolides is biaxin, also known as clarithromycin. So often we'll use that one. Okay. And then the other family of antibiotics that's very closely related to the macrolides in terms of its mechanism of how it works are the tetracyclines. So doxycycline, minocycline, and tetracycline. And so those probably can be used interchangeably with the azithromycin because on the idea that it may help prevent your Babesia from becoming resistant to the main anti-malaria agent, atovaquone or malarone or whatever else you're wanting to use, okay? All right, now, one other point though, it used to be an old-time way to treat malaria, used to be doxycycline. So doxycycline is an old-time malaria treatment that doesn't work anymore. There are still some parts of the world that you can go to where you use doxycycline when you're there as your preventive. You take it to prevent getting malaria, all right? So doxycycline, even though it's never been directly studied to see does it help with Babesia, probably does, because we know it works against malaria in the past really well until malaria became resistant to it, okay? But also it works in a similar fashion, how the mechanism by which it works as the azithromycin does, okay? All right. I hope that answers your question. Let me see if there was any other part to it. So antibiotics in this situation, of the ones I just mentioned, do help kill the Babesia. Their role may be more of a minimal role. It may be the major anti-malarial, like an atovaquone, a malarone, that may do most of the work, okay? All right. Thanks for that question, son. Hello, Brandy. Let's see. What are some of the similar symptoms of COVID shared with Lyme and its co-infections? What are some of the distinguishing symptoms of COVID from Lyme and co-infections? Oh, what are the similar ones and what are the distinguishing ones? Boy, it's a good question. I mean, I'll start by saying maybe sometimes it's not always clear. The big distinguishing symptom, though, would be respiratory symptoms that many people with COVID get. I would not consider those to necessarily be part of Lyme or co-infection. So having a lot of the breathing difficulty, that dry cough that sometimes people get with COVID, those are things that I would say are more unique to COVID. And getting those with a high temperature would probably tend to be more unique to COVID. But COVID, like Lyme, like co-infections, also triggers cytokine excess, which means you can have a lot of similarity, meaning they all can give fatigue. So what does cytokines cause? Cytokines give you brain fog, give you fatigue, can cause hormonal dysfunction, give you achiness. So all those symptoms, they're going to be the similar between Lyme, Bartonella Babesia, other co-infections, and COVID. Okay, so I think that answers your question. Sometimes it can be hard to distinguish. The one thing you can use to distinguish is get a COVID test. And if it's positive, then maybe it is COVID causing those things, okay? All right, thanks for that question. Hello, Tim. Let's see. Hi, Dr. Ross. Thank you for all you do. You're welcome. Is there anything I can do besides treating the infection to stop the ridiculous amounts of sweating all throughout the day? I think it's Babesia. Thank you so much. So sweats are interesting. So let me just say a few things about sweat. So generally, when there is excessive sweating, we wonder about Babesia. But it's not always due to Babesia, though, all right? So let me talk about that a little bit further. So Babesia tends to give excessive night sweats. Bartonella can sometimes give excessive day sweats. And sometimes Babesia gives you both, all right? So whenever there's excessive sweating, you also got to wonder, is there Bartonella in there too? Although we tend to think more Babesia, okay? Now, how do you tell if Babesia is there? Well, Babesia usually isn't going to cause just sweats alone. There usually is going to be some other symptoms that are kind of making you wonder about Babesia. So one of those can be lots of air hunger. Sometimes it can also be having a lot of headaches, especially in the front of the head. Getting dizzy easy on standing. Having very frequent deja vu episodes. That's kind of one of the more strange symptoms of Babesia, but sometimes people get that, okay? And then also having periods of racing and skipping of your heart. Those tend to put you more, if there's a number of those you have, that put you more in the Babesia realm of symptoms, okay? And then one last thing to consider with sweats, having too many cytokines. Excess cytokines can give you sweats. So when you get the flu and you sweat a lot, that's because the flu virus triggered your body to make too many cytokines, all right? And it was those cytokines that made you all sweaty and even gave you that high temperature as well, too. In terms of what can you do, I would get on something that's anti-cytokine, see if it makes a difference. I am not aware of any other ways of lowering them. So what's anti-cytokine? Well, you could do curcumin. I like using liposomal curcumin, a product called Riva 500. You can do 500 to 1,000 milligrams 3 times a day. I also might look at using a product by Research Nutritionals called Cytoquel. Cytoquel has a number of agents in it that work in different ways to lower cytokines as well. That would be 1 pill 3 times a day. That might make a difference as well too, okay? All right, good luck to you, Tim. Thanks for the question. All right, hello, Anna. Hold on here, just I gotta get a drink of water here. All right. Hello, Dr. Ross. I've been for 8 months on the following regimen for Lyme and Babesia, which is lab confirmed. Nystatin, hydroxychloroquine, sulfatrim DS, which is Bactrim, everyone, cefuroxime, atovaquone, proquinol, which is also known as Malarone, coupled with herbals, biotoxin, and biofilm busters, along with gluten, lactose, sugar, and yeast-free diet. Over the months, I have experienced almost 80% reduction in neurologic pain, improvements in general functioning, however, felt very tired. The antibiotic regimen was stopped due to high creatinine levels and low GFR readings, and a mold regimen was introduced. After a couple months on it, most of the symptoms were back. What antibiotics would you suggest to restart to avoid nephrotoxicity? Is pregabalin, which is Lyrica, and Ultram compounding the nephrotoxicity? Thank you. All right. So of the regimen that you are on, if I look through that and I look at what likely would be giving nephrotoxicity, which means injury to the kidneys, everyone, it's the Bactrim. I don't mean to second judge your doctors, and I don't know your whole story, okay? So I'll always start by saying that. But if in a similar situation where I've got somebody that's doing well and I start seeing their blood urea nitrogen, or also known as BUN, creatinine, start becoming elevated, my first move on a regimen like this would have been to stop your Bactrim, actually, also, which is sulfatrim, is what you said here, okay? And that usually is the culprit. The other thing that you're on, cefuroxime, I don't think of. Tovachrome proquinol usually does not do that. Nystatin stays in the intestine, so it's not absorbed to give any systemic side effects. Hydroxychloroquine, I've never seen it do it. I mean, presumably it might, but I've never seen it do it. And I've used a lot of that in my practice as well too. So yeah, I would think about building a treatment that did not have the sulfatrim in it, okay? In terms of the Lyrica and the Ultram, no, I don't think of those as leading to kidney dysfunction as well too. All right, now let me make a comment here. So when you are being treated for something and you stop antibiotics, or I'm sorry, when you're being treated for tick-borne infections and you stop antibiotics and you're not done, you can kind of get some clues as to what might still be active depending on when the symptoms came back, okay? So usually, so Bartonella and Babesia both replicate, regrow more quickly than Lyme does, all right? And both of those germs replicate about every 24 hours. So they're regrowing themselves within 24 hours. Which often means within a week to a few weeks, most of your symptoms will be back if they have regrown. That's usually, okay? On the other hand, the Lyme germ replicates about every 4 weeks to every 8 weeks. And often when people get into a decline after that treatment is stopped too soon, it's at about 1.5 months to 2 months before they start getting symptomatic, okay? And so the way you wrote this question, you said after 2 months, you started getting worse. That has me wondering, maybe it's more of a Lyme issue now and not so much a Bartonella or a Babesia issue. Now, granted, I would have to ask you a lot more questions to tease that out, but I just want you to look at that, okay? And have your doctors help you look at that as well, too. The other comment I would make is your treatment was pretty good for Babesia. I mean, you're on the atovaquone, or Malarone, excuse me. You're on the hydroxychloroquine, which is another quinine-like medicine. You're on Bactrim. Bactrim is another medicine we can use for Babesia as well. And Bactrim also can sometimes help with, can sometimes be part of a Bartonella treatment as well too. So you were covering all the germs here, but that time, but usually, just so you know, at Babesia, which you tested positive for, typical length to treat Babesia is about 4 to 5 months. So in all likelihood, you probably should have been done with that treatment too, just by judging by the length of time. So that whole scenario has me wondering more in your situation, is it more of a Lyme than it necessarily is Babesia that came back? Okay. All right. Good luck to you. Hello, Karu. Let's see. After 3 years treating with herbs for Borrelia and still feeling ill and fatigued, last week I woke up in the middle of the night with the front of my shirt soaked in sweat. I also had a dry cough 2 nights and my wrists were very itchy. Is this diagnostic of Babesia? I thought I only had Lyme. Will doxy or tetracycline help with Babesia if that's what I have? I also recently started experiencing soreness on the sole of the left foot and wonder if I may have Bartonella too. All right, so in terms of Bartonella Babesia symptoms, keep in mind that just getting an episode here and there does not mean you have the illness. So waking up one time with drenching night sweats does not mean that you've got Babesia. You want to see a pattern of it. You want to see like almost nightly that you're having night sweats. Foot pain that's Bartonella is not going to come and go. It's going to be there. And usually it's going to be there every morning, worse than in the afternoon. And you can start to get it better as the day goes on. So it isn't a pain here or there. It isn't a sweat here or there. It's more that they are happening really consistently. Okay. All right. Good luck to you, Karu. Hello, Frank. Frank says, from Frank, hi, Dr. Ross. So I want to say hi back to Frank. Hello, Cesar. Let's see. Hi, Dr. Ross. Can azithromycin increase your heart rate or cause an irregular heartbeat? Also, is it best to take multibiome probiotic with or without food? All right. So I'll answer both parts of that question. So the azithromycin is in a family, again, called the macrolides, of which the other member is clarithromycin. Both azithromycin and clarithromycin in some people can trigger heart skipping around. So yeah, it could be coming from that. And so when that happens, usually I just get people off of it and go over to the tetracyclines if I need to. Now, just because azithromycin is giving you heart skipping around does not mean clarithromycin will do it too, but just realize there is a slight increased chance that clarithromycin can. Okay, all right. And then in terms of the multibiome probiotics, everyone, multibiome is a product that is manufactured by Research Nutritionals. It is composed of two general families, or I should say types of probiotics. One type is a spore-forming soil-based probiotic, and the other kind are probiotics or bacteria that we would find normally in our intestinal tract. Okay, so human strains of bacteria. The reason we are more and more, we're starting to combine those. I either have people take human strains and spore-forming strains as separate products, or Research Nutritionals just came out with this product that has it all in one. Okay. Now that multibiome, the reason you want to do a spore former with a regular human strain is spore formers, which come from soil, help support the good bacteria in your intestines to do better. That's already there. And they may help the human strains of bacteria also to gain a foothold when you're taking them as supplements too. There are no studies that I've been able to find that say that these spore formers actually wind up populating your intestines, but they help support intestinal function. They help support immune function as well too, okay? So more and more, we're working with both together, all right? This multibiome product I'm finding to be very helpful with patients. I have people take it with or without food. I think ideally it's probably better with food, but you're gonna get absorption and help taking it either way, okay? And yeah, anyhow, I think I just answered your question here. All right. Good luck to you. Hello, Thomas. Let's see. What side effects of COVID are not resolving in long haulers? What are you proposing to treat COVID long haulers with? Is there a protocol for people who have gotten long-term damage, such as loss of taste, smell, etc.? What are you using to treat acute COVID when you first get it, including support supplements? Thank you. Boy, that's a big question. Let me kind of just walk you through some ideas that I'm looking at. So there's a lot we still don't know about long haul COVID. We just don't. There's a lot of research that's being done. There's ideas that there's not much research yet being done. We're waiting for research to let us know what is happening, okay? But the way it's behaving is very similar to what we see with symptoms we have in chronic Lyme and symptoms we have in people that have chronic fatigue syndrome as well too, all right? So when people basically get long haul COVID, they often are going to continue to have a lot of fatigue. They're going to have a lot of cognitive dysfunction. They may have dizziness. They may have ongoing body aches. These all suggest symptoms of excess cytokines. Okay. It is postulated that one of the reasons that this may continue to happen is that the white blood cells that have attacked the COVID germ may not be able to quickly get rid of all of the virus parts. These are a type of white blood cells called monocytes. And that because they are constantly still trying to get rid of the dead virus parts, it triggers the immune system to keep overproducing these cytokines. Okay, so that's And so it could take months for this to clear. It does appear that most people with long-haul COVID eventually are recovering with time, but there are some additional things we can do rather than just waiting for this to happen, okay? So number one, with my long-haul COVID patients, I'd like to get them all in something that's going to help start balancing and limiting cytokines. And what I like using are the same things I use in Lyme. So we could either use Mariva 500 3 times a day, which is a curcumin tablet. You could use Cytoquel, which is a research nutritionalist tablet, 1 pill 3 times a day. Okay. And so that's one of the things I like to do. Okay. In a more acute setting, one of the reasons, and by more acute, I mean, let's say we're about 2 weeks out to 4 weeks out from somebody having just had COVID and they're still sick. I think there's enough evidence to suggest that they may still be feeling poorly because they may still have active virus in them, even though they may not test for it up here with a nasal swab, right? So in situations like that, I usually am going to want to do at least a month trial of working with ivermectin. There is some questionable, I use that word questionable research that says that ivermectin might be helpful at killing COVID. And I will say that on the whole, it's hard to say for sure if it does, because the research quality is pretty poor. But there is some science out there that says that that it can kill COVID. There's a reason, that there's a mechanism by which it does that. So if somebody's coming in and let's say they're maybe within a month of their COVID and they're still really symptomatic, I might put them on ivermectin dosed anywhere from 2 to 4 milligrams per kilogram. I may do that on the first day, repeat in about 3 days, and then probably do that weekly for about 4 times, just to see, do they have living germ in them? Can we kill that and make a difference for that? Okay. I will tell you, we don't have solid science on this. All right. Nor do we truly have solid science that says ivermectin works, but there is science suggesting it might. Okay. All right. The other thing that science has told us, and this is limited science, is that in the more acute setting, meaning within 2 to 4 weeks or so of getting COVID, and if somebody still has a lot of symptoms, there's some research showing that the antidepressant medicine called fluvoxamine may be able to help symptoms too, probably by lowering cytokines. And so I would have a person go on that twice a day for about a month as well too. Okay. All right. And then other things that I want to look at, the syndrome that develops for a lot of these people is they actually wind up developing symptoms also that suggest POTS, or postural orthostatic tachycardic syndrome, which is your vagus nerve up here in the neck that's supposed to regulate your blood pressure just isn't working correctly, okay? And so there are some treatments you can do for that. One is increase your salt intake, about 1 teaspoon a day. You may need to get support stockings to keep your blood pressure from dropping. And then the other thing that can be helpful with that and can help with another syndrome that can develop as part of post-COVID, which is mast cell activation syndrome, is to do a low-dose naltrexone. Low-dose naltrexone is something that can help modulate the immune system, okay? All right. And so that would be another thing to consider doing as well, too. All right, then, in terms of things to look for then too, is to consider if there might be mast cell activation syndrome. So mast cells are your allergy cells, and if they get overactivated, they're going to wind up releasing lots of histamines. Histamines can give you a lot of that brain fog, give you a lot of fatigue. But usually you're going to start reacting to things in the world around you or to your food, or might have a lot of allergy rashes that will suggest that's happening. If there's a clue that's happening, then you want to do things to stabilize your mast cells, like take quercetin, 2 pills 2 times a day, for instance, which is 500 milligrams 2 times a day can help with that. You might also want to get on some cromolyn. There's a variety of things you can do to stabilize your mast cells, all right? The last thing that I'm doing with my regimens for people that have post-COVID syndrome is working to support their mitochondria. Mitochondria are their cell energy factories. And the reason I focus on that is whenever you have chronic infection going on, or an infectious state or a post-infectious state, the immune system, and having tried to deal with these infections, is going to overproduce oxidizing agents. And those oxidizing agents can lead to damage to the covering on your cell energy factories called mitochondria. And that can lead to ongoing fatigue. So in addition to all these things I said that I like to do, I also will put people on supports for their mitochondria. One of those is to be on glutathione. I usually like to use a product by Research Nutritionals called Trifortify, and that's a liposomal glutathione. And glutathione is a restorative antioxidant that fixes everything, okay? And we need to fix the mitochondria from the inside, and that's what it does. And you do 1 teaspoon a day of that product. Then you need to do repairing of the covering of the mitochondria. And for that, I like to use something called ATP 360, which is a product by Research Nutritionals also that does repair of the mitochondria covering. And that ATP 360 I would do as 3 pills 1 time a day. Okay. All right. Now I'm going to show you some resources to take a look at here. In terms of what to do acutely, I have a whole article that covers that. It is true, I probably need to come up with an article that talks about what to do for post-COVID, which I'm trying to figure out how to work with at this point too. So I haven't put together an article yet, but I'll probably be doing so coming up here. So let me show you some recommendations out there. So first of all, I'm going to show you a recommendation at my website, which is about what to do for acute COVID. Okay. So this is an article that I wrote, and last time I updated was December, but the recommendations around what to do around acute COVID, I think are still fairly active, are still fairly good, okay? So, so down here in this section, I talk about what to do if you get it and acutely. Number 1, get an ivermectin, 150 to 200 micrograms per kilogram 1 time and repeat in 3 days. Zinc picolinate can be helpful. Zinc is useful at blocking one of the replication enzymes. Quercetin is useful at helping to let the zinc into the cells to block that replication enzyme, okay? Decrease the cytokines I was talking about with your curcumin and your glutathione. Vitamin D seems to be useful at helping to support this as well too. And an acute situation like people on aspirin, mainly because of there's increased chances of blood clotting in the acute situation. Okay, all right. Then, in terms of an article to take a look at about what ideas you should look at in COVID long haul. There is a group called the FLCs. I'm looking now up here real quickly. All right, so there's a group called the Frontline COVID-19 Critical Care Alliance, and this is their website right here, okay? And they have a protocol about how to manage long haul syndrome, of which I just talked about part of it to you. This is where I talk about the ivermectin protocol, okay? The fluvoxamine you might want to use. I also talked about what to do to possibly treat mast cell activation. They're not as strong in here about dealing with anti-cytokines using herbs as I am, and they are not as strong in here about supporting mitochondria. I would do those things I just mentioned in addition to this, okay? All right, now this group is really heavily promoting ivermectin to save the world, meaning they're even proposing it as an alternative to the vaccine, which I strongly disagree. The data that they show here about ivermectin success, the research data is suspect as to whether it's fully credible or not. And by that, I mean as to whether we really have ivermectin effectiveness in an acute setting. But in terms of whether it can be used on a regular basis to prevent getting COVID-19, the 3 studies that they cite are extremely small, and the ability to not get COVID was actually questionable. Maybe it works as a preventive, maybe it doesn't. The only studies we have that clearly show you a way to not get COVID are the studies about the vaccines that show vaccines work 95% of the time. That, to me, still is the most effective way to make sure you don't get COVID. All right. Thomas, there you go. Those are my thoughts. Good luck to you. Hello, Mike. Good afternoon, Dr. Ross. Which medications are effective for treating the Bartonella persisters? Thanks for sharing your knowledge. So to be clear, we're on the same page. I think we may be, but let me just do a definition here for a minute. So everyone, about a year and a half ago now, there's a research that came out that shows that that Bartonella, just like Lyme, may be evading our best efforts to get rid of it by developing what are called persister state. Okay, so what that means is, like Lyme, Bartonella has a growing state, or it's growing, okay? And then it's got a hibernating state where some of the germs, maybe 10%, maybe 20%, go into hibernation when they're exposed to antibiotics. And in hibernation form, they ignore us. They just ignore those antibiotics we throw at them, all right? So the antibiotics don't work. So the studies that have been looking at what to do for persister Bartonella are only about a year old or so. So we're still learning, all right? What I can tell you for sure is disulfiram does not. Okay, so the Johns Hopkins University, Dr. Ying Zhang's lab did research on disulfiram and showed that it does not. And actually, that's my clinical experience too. I don't think disulfiram works well at all, actually, for Bartonella. In laboratory experiments, they've shown that using cinnamon, clove, and oregano oil, or even oregano oil by itself, has the ability to break up Bartonella persisters and can treat the break up biofilm too. So break up biofilm and also treat persisters, okay? Probably those also treat growing forms of Bartonella as well too. In terms of a prescription antibiotic that would have to be compounded, you could also use something called methylene blue. Methylene blue has to be made up by a compounding pharmacy. Before you start methylene blue, there has to be a blood test done to make sure that you are going to be able to handle it. So methylene blue can cause a rupture of your red blood cells if you are low in an antioxidant called glucose 6-phosphate dehydrogenase. So you want to check a glucose 6-phosphate dehydrogenase level before you start your methylene blue, okay? And the pharmacies, there's 3 pharmacies I found that compound it nationally. Maybe there's more, but most pharmacies won't touch it because the stuff is just messy as hell. It turns everything blue in the lab. You'll find if you use it, it's going to turn everything blue that you pee on as well too. And you almost have to clean your toilet each time, basically, all right? So methylene blue is a prescription. And then Ying Zhang in his lab, same researcher at Johns Hopkins, showed in his lab that an antifungal called clotrimazole can be effective against persisters too. That is not made in an oral pill, and so you can get that compounded. I haven't been trying it though because I'm finding good success using methylene blue and using the liposomal cinnamon clove oregano oil, okay? But yeah, just to make you aware of that, okay? Now, what's interesting about Ying Zhang's experiment where he looked at what works on persisters and what works on growing Bartonella, he basically chose a member of each class. So rather than testing every tetracycline, he only tested doxycycline. Rather than testing for all of the antifungals in the family of clotrimazole, he only did clotrimazole, all right? So it raises a question, would fluconazole, which is diflucan, work? I don't know, but if clotrimazole does, maybe fluconazole would. All right, so just keep that in mind, okay? So I usually like to work with 2 antibiotics that will treat growing forms, while I also work with at least 1 or 2 things to go after persister forms. For the persister forms, either I'm working predominantly with either methylene blue or liposomal cinnamon clove oregano oil, or just liposomal oregano oil, okay? And I like using, for the oils, I like using a product by 2 products by a company called Doctor Inspired Formulations. And they make a really good quality product, and you can find it here, this Doctor Inspired Formulations. And they offer 2 products. One is their liposomal oregano oil. The other one is their liposomal cinnamon clove oregano. Now, this liposomal cinnamon clove oregano, has been out of stock until they just finally got it back in stock on Monday. All right. So I am taking orders for it now, but it was out of stock because they lost their capsule supply because of COVID. They now have a replacement capsule supply, and it's on the way. And so we are taking orders for this now. I will tell you the amount of oregano in this liposomal oregano essentials is equal to the amount of oregano in this liposomal cinnamon clove and oregano, but you also get the added benefit of the cinnamon and clove here, okay? And I don't know why, but this is a cheaper product than the straight oregano by itself. I have never gotten a decent explanation for that. But anyhow, we are supplied in both of those. You would do either one of those as 1 pill twice a day, okay? All right. Thanks for that question, Mike. Oh, by the way, everyone, I know I've showed you my supplement store. So that is the store that my patients get their supplements from. So it's the same stuff I work with my patients that I find helpful, okay? And it's available to anyone. You don't have to be a patient here to use the store. If you do choose to buy from us, I ship out of Austin, Texas, not in Seattle, Washington, where my clinic is, but I ship out of Austin, Texas, so I can reach more parts of the country easily. We've got a good shipping team down there, and we don't charge you sales taxes. I cover that if you should happen to be a place where sales taxes should be due. And we ship free as long as you have an order over $50, okay? I'm often asked, why don't you reduce your prices more? I can't. The manufacturers that I represent will not let me sell any lower than what I currently list, okay? So the way I try to save resources is to at least cover your shipping within reason, and also to pick up those taxes for you as well too. So anyhow, I appreciate your business if you choose to go ahead and do that too. All right. All right. Thanks for the question, Mike. Good luck to you. Hello, LM. Let's see. Would you give your advice regarding trying to exercise through fatigue, exhaustion, and pain without giving up? So it's a good question. It's a hard question, though, too. So there's a general rule of thumb that I tell patients when it comes to exercise and how far to push it, okay? And that is exercise to tolerance. And you're thinking, what the hell does that mean? Well, let me tell you about that. So everybody's level that they can exercise is different. And that's why I say to tolerance. So you know you have done too much if the next day you pay the price for it. And by paying the price, I mean either marked decrease in energy or big increases in body pain or worsened brain function, cognitive decline, okay? So that level of exercise that you did that led to that, that's too much. And you want to find a level that you can do that does not cause that to happen the next day, okay? So that's what I mean by exercise tolerance. And it can be any kind. I mean, for some people, it might be just walking around the block is what they enjoy doing. I tell people to find an activity they enjoy doing, and that's what they should do. I think aerobic exercise is okay, as long as you can find a level you can do that doesn't clobber you the next day, okay? That's my general rule of thumb, okay? All right. Good luck to you. Hello, Justin. Let's see. From your history of treating chronic fatigue syndrome, Emmy, what are your theories on the causes? I was reading about Incline Village with theories such as algae blooms and different strains of Epstein-Barr? Did you have any beneficial treatments that you transferred with you when you switched over to Lyme infections? So there's, in managing, so prior everyone to treating Lyme disease back in 2004, my practice predominantly was a practice that had attracted people with chronic fatigue syndrome and fibromyalgia. And the reason for that is I was working with herbal medicines as a medical doctor, and I did acupuncture. So I attracted people because of that, okay? And in 2004, one of my patients asked if I would test her for Lyme, and I knew nothing about Lyme disease back then. And I did test her, and it came back positive, which was an eye-opening experience for me, all right? But there's some core things to consider in anyone that has chronic fatigue. Number one, you need to do things to correct sleep. And if that means you got to use drugs to do it, use drugs to do it. All right. The second thing that you I incorporate this also into my Lyme disease treatments too. Okay. Second thing that I found to be helpful in most people with chronic fatigue is that because of either chronic infections or possible mold toxins or toxins in them, there is always the possibility of having too many cytokines. So I also would put them on things to lower cytokines, like a curcumin, for instance, okay? Given the degree of fatigue that most people have, there probably is some stress or strain on the adrenal glands. And so I often would put them on adrenal support using ashwagandha. And then I would always go looking to see, did they have too many yeast growing in their intestines? Because a lot of people with immune suppression from chronic fatigue, from infections, often will have too many yeast living in the intestines. You want to correct for that. I would do studies to figure out if they had low thyroid too, all right? And then that's how I would start. If that didn't work, then I would start looking at steps to repair mitochondria. And I would start looking to do studies to make sure they didn't have environmental mold toxins in them. Now, what I also know to do is to test for tick-borne infections, all right? Now, in terms of chronic virus infections, back then, I would look for them, but I would not try to do anything for them for months because I found that if you could get yeast out, balance the thyroid and adrenals, get people sleeping, and lower cytokines, often if viruses were active, the immune system would kick in and take care of it, okay? So that's just kind of a general approach. Most of the approach that you see that I've built into the Ross Lyme support protocol, you'll see basically has the foundation coming out of how do you handle people with chronic fatigue, okay? There's a lot of similarities there. The big difference is in Lyme, you've got an infection that's adding to the whole mess, okay? And in mold toxicity, you have something that's adding to the whole mess, all right? Okay, thanks for that question, Justin. Let me just do a quick screen share here. I should show you all this. All right, so actually, while I'm here, let me show you something. So everyone, I've added a new product line to the store, and I'm going to be expanding the numbers that I offer here, but it's a company called Elk Mountain Herbs, and I still have some images coming. But essentially, these are herbs that come out of Buhner Herbs. And I'm hoping over time to expand into covering many of the items that Stephen Buhner in his books on how to manage Lyme and co-infections herbally mentions. And I will be offering a number of those products here. So just keep that in mind, okay? All right. All right. Now, having said that, then, in terms of my own protocol, take a look at this treatment tab. And this is the Ross Lyme support protocol. And in this are many of the same steps I would take with somebody that has chronic fatigue. So these days, I would try to figure out is there mold toxin illness as part of it, okay? And these days, I would also try to figure out, do they have as a component mast cell activation? These are concepts that a number of years ago we didn't know about. But then, as part of chronic fatigue, fibromyalgia, et cetera, I want to get people sleep. That's what I was just mentioning to you. I like working with a paleo type diet. I like getting cytokines down. I like having people on an adaptogen that supports the adrenals. That's the ashwagandha, 2 pills twice a day. I like to correct hormonal imbalances. I like to get people on a good multivitamin. I like to support basic detox steps. And then I treat yeast. That would have been my frontline approach for anyone that had chronic fatigue syndrome, okay? Only if that didn't work, then I would start looking for other infections that might be causing it, okay? All right. And then other things that you also would consider would be, let's see, I think this. No. Yeah, so other things I might add into a chronic fatigue syndrome, I might look at doing, gosh, where is it? I'm not seeing this here. Oh, here. So these items in the 6 months and beyond of other things I would start looking for are also things to look at in chronic fatigue. If you try the basic program I just mentioned up through treating yeast and you're not getting better, then you want to look at Lyme. You also want to look and see if there's mold toxin illness. You might want to look to see if there's heavy metal detox problems. You might want to look then at that point for chronic virus infection problems. And these days, more upfront, I'm trying to correct for mitochondria problems as well, too. Okay? All right. All right. Thanks for that question. Hello, Carter. Let's see. Do any of the Lyme and co-infections cause ptosis or tired, droopy eyes, or is that underlying genetics exacerbated by infection? I also feel like I have no spine and neck stability to hold proper posture. Any suggestions? So the ptosis, which means dropping eyelid, is a neurologic dysfunction often. And yes, either Lyme or Bartonella could trigger that, okay? Also, you're correct. I mean, some of us have an underlying predisposition for that, all right? In terms of the spine and neck stability, I might work with a physical therapist to see if they can give you some ideas on strengthening, if that's possible, okay? And get them to do an evaluation as well, too, okay? All right. Good luck to you, Carter. Hello, Audi. Let's see. Hello, Dr. Ross. I took ATP fuel for 2 months. Chronic fatigue went away. 10 pills a day, too much, and stopped. After a month, fatigue is back. Can I take less pills a day and still see results? Do I need to take ATP fuel for the rest of my life? Should I get checked out to find out why chronic fatigue is back? Or just keep with the ATP fuel since it seems to work? All right. So Audi, one thing I would suggest doing to make it easier on you is replace the ATP fuel with a newer product that has come out by research nutritionals called ATP 360. All right. So both of these products are made by research nutritionals. The older product is the ATP fuel. A newer product, which is meant as an upgrade to the ATP fuel, is ATP 360. Now, ATP 360 uses a phospholipid mix that was developed by research nutritionals. So the phospholipid mix is to repair the mitochondria covering. In ATP fuel, the phospholipid mix is something called NT factor that's developed by another company. Okay, so research nutritionals decided to develop their own. But it looks like their way they did it actually works better than what the NT factor in ATP fuel does. There's studies that show this ATP 360 is a better product. You get better repair of the mitochondria using it, okay? So the way you use the ATP 360 is it's just 3 pills one time a day, not 5 pills twice a day. It's an easier thing to do. I'd give it, try that, and I would try to give it at least a 6-month try. I also suggest for mitochondria repair, is to be on the antioxidant glutathione that can help repair your mitochondria from the inside. And the product I like for that is a product that is manufactured by Research Nutritionals called Trifortify. It is a liposomal glutathione. Liposomal means it's microscopically wrapped in fat to increase absorption. They've got good studies also showing good absorption, which is why I recommend it. And you would do a teaspoonful 1 time a day. All right. All right. Good luck to you, Audie. Hello, Heather. Let's see. Hi, Dr. Ross. Oops, hold on here a minute. Let's see. Within 4 months, my ferritin level went from 36 to 12, and my iron levels went from being on the high side of normal to the lower side of normal. My red blood cell platelets and hemoglobin have been the same. Can you explain this? I have Lyme and Babesia, but it's not new. The doctor suggested I take iron every other day and retest in a month. I've also started low-dose naltrexone a few months ago. Can that affect iron and ferritin? So I don't think that anything you're taking from what you've listed here is affecting iron and ferritin. So everyone, ferritin is the storage form of iron in the body, okay? In females, generally, the cause of low iron is heavier periods or heavier periods than average for what you would normally have, okay? Because that can be a major source of iron loss. The other thing to consider is, are you getting enough foods that have iron in them? So did you become vegetarian all of a sudden and stop having all your red meat, for instance, okay? So those would be things to consider as well, too. All right. But no, I don't think this would be from the germs. And no, I don't think this is from some of the medicines that you're taking here, okay? All right. Good luck to you, Heather. Hello, Frank. Let's see. Hi, Dr. Ross. I received my test results from my Genix and was diagnosed with Bartonella elizabethii. I was negative for Lyme and Babesia. Is there a recommended treatment for Bartonella elizabethii? So it's the same treatment that you would do for any species of Bartonella, all right? So, Frank, you could take a look at my How Do You Treat Bartonella article, where I give you lots of ideas on how to approach that. But no, it's the same treatment, no matter whether it's a Bartonella henselae, Bartonella cantana, or Bartonella elizabethii. Okay? All right, let me show you the article that you can take a look at there. All right, so take a look at my infection treatment plan section here. Take a look at the article called Kills Bartonella, a Brief Guide. Okay, and this is where I lay out what to do, and I even talk about persisters in this article as well, too. Thanks for the question, Frank. Good luck to you. Hello, Cheryl. Let's see. I've had Lyme disease ×3 and was recently bitten again. I'm currently on a 21-day course of doxycycline. Should I take something long term? I don't know. I need to know a lot more things. I need to know, do you get well each time with your doxycycline, or do you have symptoms that persist? I need to ask you a lot more questions. That's a hard one to answer. I need to know what your symptoms are, even when you get off of antibiotics, okay? All right. Sorry about that, Cheryl. Hello, Dr. Ross. What is your opinion on the organic acids test by Great Plains for health assessment? Currently treating Lyme and mold. I have a very high number for quinolinic acid. I have read about tryptophan, steel, and have some days have very poor cognitive function. Does this relate at all to Lyme or mold, or is this something completely separate? Thank you very much. So Patty, I only rely on the organic test from Great Plains to help me look at one thing, and that is to help me figure out if somebody might have too much yeast living in their intestines. I am not clear about the reliability of organic testing, acid testing for most conditions, all right? What I do know is I have found some correlation between elevated arabinose levels and whether somebody has too many yeast that will benefit from me putting them on yeast killers in their intestines or not. So I would say I'm not sure if the rest of the information is beneficial. I happen to just use one aspect of it for my practice. Okay. Thanks for the question. Oops, let's try that again. Hello, Patty, again. Let's see. Hello, Dr. Ross. My LMD is currently treating my candida with terbinafine. She recommends 12 weeks. I have had an issue with fatty liver and elevated enzymes in the past, so I have concerns. Currently, my liver looks okay. On your site, you mentioned terbinafine, but seem to prefer the azoles. Any reason for this? Thank you. In my experience, I tend to find the azoles to be more effective than terbinafine. Terbinafine, everyone, is also known as Lamisil. Lamisil has a good approval for treating toenail fungus. That's what it's approved for, okay? It's not actually approved to treat yeast in the intestines. Now, if it's treating one kind of fungus, yeah, it probably can treat yeast too. Clinically, in my experience, I find that the azoles will work about 90% or so of the time. 95% of the time, I should say. The terbinafine, I find it works about 80% of the time and tends to take about 2 months, versus the azoles often will have things in control within a month, okay? So that's the big reason I handle it differently, all right? Okay. Good luck to you, Patty. Thanks for your question. Hello, Laura. Let's see. I hope that you have a good time with your dad in Colorado. Me too. Me and my 90-year-old dad. It's going to be an experience. He's still pretty vital for 90 years old. It's pretty amazing, actually. But he's got his opinions, so I get to hear those. So I take it all with a grain of salt and a lot of joy these days, because I know there's just his days on this earth are limited, unfortunately. So yeah, thank you for that. Hello, Suzanne. Can post-COVID and Lyme lead to depression and brain fog? The answer is yeah, they both can. Either one of them could lead to depression as a situational reactive depression, meaning you feel bad and you get depressed for that reason, okay? But also, both of them trigger cytokine excess, and excess cytokines can trigger depression. And then depression triggers excess cytokines, and it just becomes this endless loop, okay? So yeah, they both can. And cytokines triggered by them can also both lead to the brain fog as well too, okay? Thanks for that question. Hello, Louise. Hello, Dr. Ross. Huge thanks for all your help. I wonder if it's okay to take antibiotics and herbal treatment at the same time. I have Lyme and BART, currently on doxycycline and azithromycin, and I wonder if adding cytokine and hypothyroidism might be helpful. So I will mix them together at times in my practice. It all depends on how reactive or not reactive you are to different things, meaning somebody that's very reactive to antibiotics, I may not put them on as many, including the herbal antibiotics. If somebody is not as reactive, but we're stuck, I might go ahead and add like a cytokine and a hypothyroidism to this kind of a mix of things to see if we can move the Bartonella along too. Okay. Good luck, Louise, or Lewis, I should say. Hello, Laura. See, if a Canadian who lives in Canada were to have you as their LMD, what are the rules or challenges related to having you as their doctor? And B, getting antibiotics in Canada with US doctor's prescription? All right, so Laura, at this time, just to be honest with you, I'm not taking new patients. My practice is very full. And also I've down an office staff member while one of my members is out on pregnancy leave. So the logistics are, I'm not even going to consider taking somebody for at least another 2 months or so. All right. So if we do open it up in another 2 months, that's if I'm still trying to decide what's going to happen in terms of that. For my Canadian patients, I want to see them here in office at least about 2 to 3 times a year. And in terms of prescriptions, I wind up working through a pharmacy in Canada called Cripps Pharmacy, where I can send prescriptions and have a physician that rewrites them for me. Okay. But it's not clear to me whether I'm going to be opening back up anytime soon. So just keep that in mind. Okay. All right. Thanks for the question. Hello, Sarah. Let's see. Hello, Dr. Ross. How do you find an unrelenting, what do you find an unrelenting boat rocking type dizziness vertigo to most commonly be associated with? Babesia sometimes can give you a kind of a rocking or can't keep your balance type of vertigo, but also actually any of them. It could be Bartonella, it could be Babesia, it could be Lyme. I wouldn't say this is specific to either one of them or any of them. Okay. In other words, it's going to occur with all of them. All right. Good luck to you, Sarah. Hello, Lewis. Again, let's see. I read an interesting study named Identification of FDA-approved drugs with activity against stationary phase Bartonella henselae, where 41 drugs were confirmed by microscopy to have higher activity than the current frontline antibiotic. Daptomycin, methylene blue, azole drugs should treat BART better. I wanted to share with everyone and have your opinion about it if you had time to read it. You know, I have not seen this specific paper. I'll be glad to take a look at it and see if there's some thoughts I have. It's not inconsistent with some of the things that we're seeing right now with the methylene blue that I've seen in other studies. The azoles, we've got some evidence of that. And so anyhow, yeah, I'd have to take a look at this. I'd be interested in looking at it. I'll have to go look and see about it. Okay, thank you. Hello, Audi again. Let's see. Can taking ATP fuel cause cytokine production? I haven't seen it do that. Now, that doesn't mean anything can happen, but I haven't seen that happen, Audi. Good luck to you. All right, everyone. That's it. I've got 2 Basenji dogs waiting for me at home that I got to ride my motorcycle home and get them out. And so we'll be doing that here in a little bit. Been nice being with you here tonight. Tomorrow morning, keep your eyes out in your email. There will be an email coming out announcing that the recording is ready. And hopefully this time I set the recording right so that you actually get to watch it. Again, last week I had it set for private setting instead of having it set publicly. I hope I'll do it correctly this time. I will send you a summary of what we discussed tonight too in that email. And also in tomorrow morning's email will be a link so you can sign up for the next series of webinars too. Please share that email. Let other people have this information and share with them so that they can sign up and join these webinars in the future as well too. I'd appreciate it if you'd help me with that. I'm trying to reach as many people as I possibly can to help as many people as I possibly can. All right. So I hope you all have a good couple weeks. And thank you for joining me here tonight. And good night, everyone.